Hey everyone, Dr. Q here. As you may know, Italy has been hit hardest in this pandemic of COVID-19. And what you may not know is that the United States is just about 2 weeks behind them. Therefore, I had the pleasure to connect with Tanya Castagna. She is an RN nurse who is from Baltimore, Maryland, and she graduated from Stevenson University. She did her practice for 3 years at Johns Hopkins Hospital, and now she resides in Sardinia. It's an island region which is 250 miles away from Rome. Hi, Tanya.
Hi.
How are you doing today?
I'm fine, thanks.
Okay. Well, thank you again for doing this for all of us. I really appreciate it, and so does my audience. I'm going to go ahead and start with our first question. Okay.
Okay.
When did you first become aware of COVID-19?
In early January, I remember seeing it on the news for the first time, and I remember seeing the situation in China. It just seemed chaotic, and it was a new virus, and I didn't quite understand what was going on, but I just started to think in my mind that it was a new virus and it was causing a little bit of chaos there, but it was nothing really that I had to worry about because maybe it was there and it wasn't in Italy. And I started to continue to follow it a little bit, but statistically, it just didn't seem dangerous to me because statistically it seemed less dangerous than the regular flu. So I really didn't feel too concerned at the time.
Yeah, I think that's a common thing that's going around here in the United States as well. It's in China, it's not here. Oh, it's in Italy, it's not here. And then now in the United States, oh, it's in New York, it's not in Texas. So I think that's just kind of a common thing. So when did COVID-19 first hit Italy, and how did you guys test for it?
Our first case was detected on January 31st. There were 2 Chinese tourists in Rome. They were hospitalized and they tested positive for the coronavirus. And a week later, an Italian man in the north of Italy was tested. He had recently traveled to Wuhan, and so he was hospitalized and tested positive. So there were 3 cases. And I was not really concerned because I just realized that, it's a virus and they were in China. And of course, it probably will come here too without any concern whatsoever. Because again, being in denial, I was still comparing it to regular flu. So there were 3 cases. And then on February 16th, we had an additional 16 cases. And then on the 22nd, an additional 60 cases. And then I started to realize that things were starting to progress, also because we also received our first case here in Sardinia. And so the situation started to become more and more interesting to me.
So were you still worried at that point, or were you still more like in denial?
I was starting to become concerned. Let's put it that way. I was starting to become concerned because the numbers were starting to multiply. It was going fast. And but I still didn't understand, and I still was in denial about the situation. And I knew that it would probably affect us, but I didn't realize at the level. I didn't understand the situation. I didn't understand the severity of the virus.
So it seems like it was a fast progression. So the first case in January 31st, and then you saw more on February 16th, and then you said where you guys were at 60 cases at one point. So
February 22nd.
22nd, yes.
Right. And then including the first case in Sardinia. So we're talking, a matter of weeks. And immediately on March 4th, they unexpectedly closed all universities and schools.
Wow.
So I realized at that point that this could be serious.
That's a fast progression from getting all those cases. And then Italy seems like they acted actually pretty quick. They had a shutdown within a month.
Well, yeah, but the situation in the hospitals were already bad.
Oh, wow.
I mean, in 3 weeks, it's insane, the situation in Italy, how fast it happened. Really, from the first case till the time that we got lockdown, Um, then on March 6th, I received a letter from my hospital stating that all emergency cases were going to be canceled. So from the 4th, they closed all schools. 2 days later, I received a letter saying that the hospital was going to close all non-emergency cases. It just seemed like every day I was receiving more messages of panic, of an emergency. So I really started to understand, probably at that point, that we were about to face an epidemic, and probably even in Sardinia. So I started to pay more attention to the news. On March 8th, the whole entire country became on shutdown. So I had literally days, just a matter of days, to go from being in denial to finally facing the fact that this was a real emergency. And I had no idea. Of the severity of this.
That's very intense, going from one extreme to another. So it's like your life literally changed in a matter of few days.
Yes.
Did you guys get any type of time to prepare for this or anything like that? No.
Not really. No, not really. I mean, the day that they closed all schools, for me, it was just another regular day. I mean, it was just another regular day. There were cases in Italy. There was already a case in Sardinia. But for me, I was living life as if nothing was happening. For me, everything was under control. I was the first one. I'm a nurse. I was the first one who was in denial. I was the first one.
Yeah. How did you guys treat and prepare for COVID-19? What protocols are in place?
So once the hospitals canceled all their non-emergency cases, the government gave instructions to the whole entire country. So we were taught to follow the rules, not to panic, and to follow the rules. So the rules are, if you suspect that you have symptoms of coronavirus, we're not allowed to go to the emergency room, and we have to call our primary doctor, and we have to listen to instructions from our primary doctor. If our primary doctor is not there, we're told to call a special number, and they will give us instructions. They will follow us. And if we are not doing well at home or having difficulty breathing, there's a team that comes to your house. They're protected. They come to your house. They do an evaluation. If they feel like you need to be hospitalized, they'll bring you to the hospital. They'll test you, and they'll put you in isolation, or they'll start to treat you as if you already have the virus.
Wow. So they're not allowed to just walk into the emergency room.
You're not allowed to go, because we're risking, the way that it's set up in Italy, we're risking to go into an emergency room, and if we suspect that we have it, it's the worst thing that we could possibly do.
And what does your state of emergency entail, and how is it monitored?
So we're on lockdown, and we're only allowed to go out for necessities. The pharmacy is open, the grocery store is open, the post office is open, and the bank is open. When we do leave the house, we have to carry documents with us stating why we're leaving. And so there are police officers roaming the streets. So they'll stop you and ask you where you're going. You have to show them the documents. If you're going out for other reasons other than the grocery store and the bare necessities, you can risk a fine, and you can also risk to be arrested.
I read something about individuals that specialize in China are coming to help out Italy. Is that true?
They came to help us. They were here about 2 weeks ago, and they were specialized, obviously, from their experience. And they made a comment that they've seen way too many people on the streets. And imagine that we're only allowed to go out to get groceries, and you get everything that you need, and the rest of the days you have to stay at home. And not everyone is doing that. Even with the pharmacy, it's the same thing. You go once, get what you need. But a lot of people use it as an excuse just to get out for a second. Oh, I have to go to the grocery store because I need this. It's not enough. It's not enough.
With everything that's going on, you're a nurse, you're in Italy, you're in the middle of all of this. What advice do you have for healthcare workers here in the United States?
I think it's really important for doctors and nurses to interact with people on Facebook, on Facebook Live, pictures, stories. It really, really helped us here in Italy. I'm in the healthcare field, and it even helped me because in Sardinia, the situation is under control for right now. I had no idea what my colleagues in the north of Italy were going through, and they shared it. They shared it, but saying the truth, they told us the importance of staying at home, how they needed us to help them. And I just think it's really important because not everybody is getting it. And the more people see doctors and nurses who are on the front line and hearing their voices, I think it will really make a difference.
Yeah, to hear it from healthcare workers instead of the media, basically.
Yes, and Americans have to listen less to politicians right now and more to doctors and nurses in this situation.
From the first cases to when it doubled, tripled, where in the map are we talking about here?
The main region is up in the north.
Okay.
So we're talking about Bergamo, Milan. That area is infested. Most of it's in a zone that has most of the cases. Okay. Even though it's all diffused around Italy, they're really feeling it, and they've been feeling it. So here in Sardinia, the situation is under control. Every day the cases are going up, but we are in quarantine, so we're hoping for the best.
Yeah.
And but in the north of Italy, it's just been a nightmare.
So think about this for a second. So you guys have been in quarantine for 21 days. Mm-hmm. So has that helped from spreading to the south of Italy?
Also, that was a little bit late because they put the whole entire country on lockdown, but there were a period of maybe 5-6 days where airplanes were still allowed to come from the north of Italy to Sardinia. We're on an island, so there were boats that were coming, and they should have probably, to really save us, they should have probably closed all of the ports in Sardinia, all airplanes. Instead, they did it after a week, which probably, hopefully, we're okay. But they also, if you're still running airplanes from one place to the other, it's hard to control a virus like that.
Yeah, exactly. Just like in the United States, they need to ban domestic traveling. So I just kind of wanted to see how you guys are handling it in terms of trying to keep it in one region at least, so it doesn't spread through the entire country. And I just hope the United States does the same thing. Do you have advice for America?
You have to stay home. You have to stay home. Even if they don't put you on a mandatory lockdown, you have to stay home, and you can make a difference. We've been on lockdown for 21 days, and we're still not seeing any results from this. 21 days inside the house, and 2 days ago, there were 1,000 deaths in Italy, our highest number. So it's painfully slow, this situation. The sooner you do it, the better. Even if your state does not tell you that you have to stay inside, you can make the decision to stay inside. The sooner, the better. And eventually, probably they will put you on lockdown. So it's just better to start now. And we all have a responsibility, and we all can start now.
Tanya, any personal experience with quarantine? Anything that you can advise us or share with us today?
Quarantine has been a really interesting experience for me. It's probably the first time ever that I've spent this much time in my own house because I'm extremely busy. I had an agenda full of appointments, and everything has just been canceled. No meetings, no school meetings, no church meetings. Everything is just on standstill. And this is the first time that I've actually been able to stop and just stay home, enjoy my home, enjoy my family. And it's given me a chance to stop and rest and reflect on life and how much life has changed. And I think about all the things that used to really mean a lot to me have been put on hold for a moment. And I'm starting to really be grateful for my health and for my house and my family. And it just seems like all the other things in my life seem so useless right now. The most important thing to me is my health and that I'm alive. Everything else just seems useless in this moment.
We're lucky that we have this modern technology that we can FaceTime our friends and family and check on each other, because I think that is the number one thing, is to check on each other and know that someone is there for you, whether, it's physically or mentally.
Exactly. Exactly.
Well, thank you again, Tanya, for your
Thank
time.
you. Thank you
So
for having me.
appreciate you sharing, Italy's experience with us. That means a lot. Thank you.
Thank you. Thank you. Baci.
As you're struggling with a sense of purpose, with what seems to be no light at the end of the tunnel, there are many things you can do. Check on a friend or a family member. Learn a new skill that you can use when this mess is over. Or perhaps now it's your time to read that book that you always wanted to read. Lastly, catch up with the friends you were never able to make time for. And remember, we are all in this together. These are just a few examples on how you can take care of yourself. Remember, your mental and physical health are very important, so please take that serious. Thank you guys again for watching, and I will have more content coming to you soon.